All right. Hello, everyone, and thank you for joining us. The Southeast Mental Health Technology Transfer Center would like to welcome everyone to the first session in a 6-part series, Keeping It Practical, Core Skills from Evidence-Based Practices. This is session 1, Tools for Self-Management, Lessons from Illness Management and Recovery. Please join us every other Thursday for the other sessions in this series. My name is Emily Moore, and joining me in moderating today's session is Dr. Benjamin Druss, Director of the Southeast Mental Health Technology Transfer Center. Please note that the work of our center is supported by a grant from the Substance Abuse and Mental Health Services Administration, or SAMHSA. And also note that our center and the larger MHTTC network use affirming, respectful, and recovery-oriented language in all of our activities. A little bit about our center before we get started. The Southeast Mental Health Technology Transfer Center is proud to serve the 8 states in HHS Region 4. Our expertise in public health programs, systems, research, and evaluation provides a unique lens through which we can address mental health priorities. We encourage you to visit the Southeast MHTTC website, mhttcnetwork.org/southeast, to learn more about our center and upcoming events. A few notes to review before today's event. This event is being recorded and will be made available on our website for on-demand viewing soon. We encourage you to share your comments throughout the presentation using the chat feature. Please remember to select chat with all attendees if you would like to share your thoughts with everyone. We have allotted time at the end of our presentation to answer questions. Please submit your question using the Q&A feature at the bottom of your screen. Finally, for participants who are interested, a certificate of attendance is available for download after completion of our evaluation surveys. I'll now turn it over to Dr. Ben Druss so that he can introduce today's speaker.
So we're really excited about this upcoming series, which will be led by Michelle Salyers, PhD. Dr. Salyers is a professor of psychology at Indiana University, Purdue University, Indianapolis. She directs the ACT Center of Indiana, a collaboration of academic and community partners, including researchers, administrators, clinicians, consumers, and family members who share an interest in recovery-oriented, evidence-based practices. The overarching goal of her work is to help adults with severe mental illness live meaningful lives in the community. Her research addresses both consumers of mental health services and the providers of those services. She's increasingly targeting the intersection of consumers and providers, looking for the best ways to support relationships that promote recovery and well-being. Her current work includes efforts to develop effective ways to reduce staff burnout and to increase shared decision-making in mental health care. Again, we're really excited about today's lecture as well as the broader series. So welcome, Michelle.
I am happy to be here. As I'm getting my slides up and going, if you guys could use chat to share where you're from, where you're tuning in from. I always love to see where people are right now, so it's fun to see. And I am in Sarasota, so I have the lovely palm trees behind me, hopefully sending warmth to the rest of you if you're in cold places, which it looks like many of you are. It's great to see so many people from around the country. So today, I'll talk a little bit about some background on evidence-based practices and where this series comes from. And then we'll dive into today's topic on self-management and how illness management and recovery could be a really good tool for that. And then I'm going to focus more on some practical tips and let you know what's coming next too. And so if you have questions as you go, I think you can put them in chat or the official Q&A place. And then at the end, I think Emily will help me sort out those questions and get to your specific thoughts. So evidence-based practices, we use that term a lot. We hear it all the time. And when I'm talking about evidence-based practices, it's really those practices that have been identified through systematic, solid research and shown to be effective for a specific target problem or population. So it could be an intervention, it could be a prevention, but some kind of practice that's been shown to be effective. And in the late 1990s and the early 2000s, this really became a big national push in treating people with severe mental illness, that several large studies like the patient outcomes and research team that studied schizophrenia treatments showed that we weren't really disseminating research into practice. And basically, research shows us what's helpful, but people aren't doing it. And so to address that, SAMHSA funded a large national demonstration project to really bring together tools to help support evidence-based practices. And they followed some specific criteria to do that. The first thing they did was to really explicitly define what the practices are and provide guidelines, implementation criteria. So they created toolkits with manuals. And they also worked with states to set up standards so that everyone knows what the evidence-based practice really is or should be. The second thing you really have to do to get an evidence-based practice into place is to make sure that you have supports for this change. Many of these practices would require a lot of change, so that agency you work for needs to be committed. There needs to be a leadership structure in place to make sure that it's supported and that there are financial resources available. So can you bill for the practice? Does it cover time for supervision or time you need to do outreach? Things like that are really important. Most of these evidence-based practices would have pretty intensive clinical training along with them. And along with that, they would have ongoing training and supervision. So we know from the research that trying to change clinical skills and practices requires ongoing commitment and feedback on how you're doing. And the last one is making sure that we're collecting data on the process and outcomes. So are people actually following the evidence-based practice, and what outcomes are they getting? And so back in the early 2000s, the ACT Center in Indiana was part of this national project. And we did a lot of training and consulting on different evidence-based practices. So I come with a lot of that background. And we found through that project that we can be effective at getting many programs established. But what about the rest of us? So a lot of us are in places that don't have standards for evidence-based practices in place, or you don't have the agency support. You might not have trainers who are coming to visit you every month and measuring your fidelity and giving you feedback. And so what happens to the rest of us? And so that's where this series comes into play. We would like to be able to review some of the core aspects of several of the evidence-based practices and bring in leading researchers and consultants who have been doing these practices for years, and then really focus on some practical strategies that you can use now to make a difference. So whether you're already part of a program that is doing some of these evidence-based practices, or if this is all new to you, there can be some take-home things that we hope that you'll be able to do now that could make a difference. And so this series starts today with this focus on self-management. And I'll be talking a lot about the illness management and recovery program, as it really focuses on that concept of self-management. And that that is really a core thing to start with, to really help clients think about what's important for their own recovery, and to give them the skills to really take on more of that management themselves. So when we talk about recovery, we're often talking about this sense of autonomy and self-determination, and those concepts really play a big key in it. So we're going to start with illness management, and we're going to build on that in the next session, talking about collaborative decision making. So as clients are being more involved in their care, how do we help them work with ourselves as providers and other providers that they might be interacting with to do decision making collaboratively, so that they have a voice in all of their treatment decisions. And then we'll get into some of those basic needs like assertive community treatment and supported housing, and bringing in a long-term consultant there. And we'll talk about employment, which is one of the key goal areas for people with severe mental illness, that they often would like to work. And then we'll cover substance use. We know that often 50% or more of our clients with severe mental illness struggle with substance use as well. And so we'll be covering that. And then we'll wrap it all up and try to pull out some of the key themes that cross all of these evidence-based practices. And I will be here with you throughout the whole series. And at the end, I'll be the speaker again to bring it all back. So before we jump into illness management, I wanted to do a pre-poll, and I think Stephanie will put a little poll up here. If you could take a minute, and there are 2 questions to answer, just to get a sense of where people are now. And I think we asked some of these questions before you joined so that I could target the level of the information today, but it's nice to know from those who signed up and are here now what your level of background is for these. Okay. So it looks like we still have some of you who haven't done the poll yet. So if you are still out there, okay. I have someone who says, oh, the poll has disappeared or it's closed. So I'm not sure, Stephanie, if you can open it or what happened. And I think some people are not seeing the poll. Okay. Well, I'll go ahead and end it since, oh, it looks like it's restarted again. Okay, sorry, I'm over here reading chat to see. It looks like it's restarted. If you could take a minute to do this one again. I'm sorry about the technical hiccups. Okay, it looks like someone was able to resubmit theirs. And this just helps us know too for our planning purposes where people are coming from and making sure that we're targeting this at the right levels. So Stephanie, behind the scenes, I don't know if you want to do the sharing of the results.
Hey, sorry about that. Yes, I am sharing on my screen, so I'm not sure why it's not popping up for everyone else. But as we expected, about 50% of the participants said they had never heard of IMR, but are not very familiar with it. And it's quite a range on the confidence level. About 10% said they're not confident in helping clients learn these skills, but about 40% are from like a 6 on up to 10 are extremely confident.
Okay, great, thank you. All right, I will close that. Great, okay, so I'll get into the illness management and recovery program. I did try to target this at a more introductory level because of the 50% or more who might not have even heard of it or heard of it but don't know much about it. I know there are a few people on here who have been trained and supervised and are doing illness management and recovery. And so if you have more specific questions, I'm happy to take those as well and also give you other resources. But just to let you know, this is more of the introductory level. So what is illness management and recovery? And it is a structured program that really helps people with mental illness be able to identify meaningful goals for themselves and set those goals, and then learn information and skills to develop more control over their illness and make progress towards their own recovery. And there is a short introductory video that was made as part of the program that has consumers talking about recovery and what it means for them. And this is available on YouTube. We're not going to do it as part of this, but it's a short video that you might check out and show your clients so they can have other examples of what recovery might look like for them. And the IMR program, the illness management and recovery, I will often say IMR now, really was developed specifically for this National Evidence-Based Practices Project. And they brought together a committee that included researchers in the field, family members, clients, clinicians, and they reviewed the literature to identify what are the effective strategies that will help support recovery. And then they put together a toolkit that has a manual for clinicians or service providers, handouts for clients, and also videos to show the skills that you might use as a clinician and videos for the clients. And also has home assignments and brochures, things like that, that you can share the information with other people. And the evidence-based strategies that are included cover these issues. So we'll work on setting and monitoring recovery goals. It includes motivational strategies to help engage people in their own recovery, educational strategies, and some cognitive behavioral things like role playing or relaxation training. And they use home assignments or homework so that people can practice, and involving significant others, so family members or other local support people for clients in their lives, and trying to engage them as well. And all of these have been shown to be effective in helping support recovery in severe mental illness. And so they were put together in this toolkit. And I have the link up here. Through SAMHSA, it is still available and it is still free for anyone. There has been an updated illness management program that's sold by Hazelden for a lot of money, but it includes the same materials that are here. And these are all free and available for everyone. So elements of IMR. IMR is put together as a structured curriculum with 10 modules, and I'll show you those topics in a minute. And the idea is that you would meet with a client weekly. I think in our experience, mostly it would be about 10 months because each module has several handouts, and depending on the client you're working with, you want to spend some time on each of the modules. And so it would last about 10 months. You can do it individually or in small groups. And in each session, you are working with people to either set a personal goal, or once you've had it set, tracking it, revising it if you need to. And as they're learning new skills, you practice those skills in the session, and you give home assignments as well. And it gives tips on how to include significant others in helping the person towards their recovery. And everything is individually tailored so that you work with the client to make it work for them. The topics are pretty broad ranging. It starts with focusing on what is recovery and helping people think about recovery and what it means to them, and setting goals towards their recovery. And there's a module on practical facts about mental illness, and this has handouts for different types of diagnoses. There may be things that are more updated that you could use alongside these handouts, but the idea is just to give a sense of what the illness is about. And there's a module on stress vulnerability, so how even happy things can be stressful. So getting a new job or moving to a new place, and how that might interact with a person's illness to give them more of a sense of understanding their own vulnerabilities. And then each of the rest of them are on different topics, like social support and medication and different things that can help people manage their illness more effectively. And here's an example from the practitioner guide, or the manual for the people who are doing illness management. It gives you the background, what the goal is for this particular session, how to structure it, and how to incorporate the evidence-based practices for each session. So it's really a nice set of tools for you as a clinician or provider for what you might do with each of the topics. So the basic idea of IMR, setting goals and seeing progress is motivating, and that can inspire hope and get people energized and engaged in learning to manage their illness better. And then we can help people get more informed and to get more control over their mental illness as they learn new skills and information. And then, most importantly, this frees people up to spend less time managing their illness and more time enjoying life. And so that's the concept behind how illness management and recovery go together. And IMR as a package gives you tools to do this more effectively. So think of it as a toolkit for you as service providers. So some practical tips for using IMR. You don't really need fancy training. The IMR project, the National EBP project, we did do 2 full days of training with clinicians. We had supervision and feedback, but the toolkits have a manual that is laid out very clearly, and you can just read it and try it. In fact, when we were first starting on this, we got a grant to study it even before the national project came out. And our very first IMR provider was a peer provider who just read the draft manuals and started doing it. And she was a person who didn't have a lot of clinical training and experience, but she cared deeply about her clients, and she was empathic and just worked her way through the manual. So you don't have to have the fancy training. There are handouts that you can use with clients and family members, and they're all free. And I know we'll post that again, the link, but that information is out there for you. You can also just take parts that help. So there are 10 modules, and sometimes people get worried about thinking, well, what client of mine is going to want to sign up for weekly sessions for 10 months? Well, you might not need to do all of it. Maybe you have a client who just got out of the hospital and you want to help them prevent the next relapse. So go to module 7 and look at that. Or you have a client who might not understand or agree with the need for medications. So there's a module for that in module 5. Let's see. You have a client who's lonely. Maybe one of their goals is to make new friends. So module 4 has some ideas for meeting that. And when we would do the trainings, I do think module 1 is always the best starting place when you're first introducing this, because goal setting and understanding what people want in their recovery is critical to all of our clinical practice. And I think that first module really gives you a lot of ideas to help get to know your clients better and what's important to them, and help them think about their goals in a different way. So I do recommend that people start with that. Modules 2 and 3 about practical facts and the stress vulnerability model, that gives a good base for understanding their illness. But you may have clients who know a lot about schizophrenia or depression and what they're struggling with. They might not need all of that. But if you have someone who's new to their illness, that might be a great next place. And the rest of them really don't have a particular order. So you can take what you want from the program and use it with your clients. And you can adapt it. It's supposed to be individually tailored. There are a lot of handouts that you use. Well, if you have a client who doesn't read, you could use the handouts yourself to guide yourself in working with them, even if the client isn't reading them or using them independently as a handout. If you have a client who hates homework, you might want to help them identify small steps towards an important goal that uses new skills or information. You might not even call it homework. You might call it practice, or let's do an experiment at home. Can you try this? On the other hand, you might have clients who love the idea about being back in school, and they get excited about having written homework and putting it together in a binder. And so you could think about that differently with different clients. You have a client who's distracted, and maybe they can't sit for a while you're doing education. You can do small pieces while you're doing something else. Are you taking them grocery shopping? Are you walking in the park? We did this training for supported housing teams in New York, and I remember someone saying they did IMR on the basketball court. They would just review a little session before they saw the client, and while they were playing basketball, they would talk through some of the ideas. So you don't have to sit down and make it like a long session like that. Are you always putting out fires? So we would often hear from people, oh, we can't do IMR as a weekly thing because I'm always putting out fires in my case management. Well, if you start to look at what's causing those fires, are these crises something that could be targeted by helping the person set new goals or learn new skills. There might be some information in IMR that could help you so that you're not always putting out those fires. And I would say if you could only do one thing differently, set and monitor recovery goals with your clients. That would be the key thing. We know that treatment goals are required for any kind of treatment in order to be billable and JACO accredited, and we all have to have our treatment goals. But to be recovery goals, they need to really be personal and relevant for the person, meaningful for them. And we know that recovery goals are important because they help instill hope and they motivate us to learn new things and can bring meaning to our lives. And not just setting goals, we need to monitor them and check in on them. How are you doing on that progress? And adjusting them as needed. So for those of you out there, if you've ever used a Fitbit or a daily habit tracker, they work. Just seeing those numbers makes you want to get more of those numbers for many of us. So making sure that you set those goals with clients and then track them. So some tips on setting goals with consumers or clients is exploring with them, how would they like their life to be different? Often when we ask, what are your goals for treatment? If they've been in treatment for a long time, they may say the things that they've heard before, like reducing symptoms or trying to be more adherent with their medication, things like that. But those aren't really recovery goals. It's how do they want their life to be different? What would they like to do in their time? What hobbies did they used to like to participate in or would they like to do now? What kind of work would they want to be doing? And so IMR in that first module gives you some different ideas of how to explore that with consumers. You should really take your time. It takes a while to get to know people and for them to get to trust you and share what's important to them. And so taking your time on goal setting is helpful. And maybe not use the word goals all the time. Sometimes that can seem daunting to people. And so maybe just talking about what they would like in their life, what kind of things would they like to be doing could be helpful for them. And we really need to let the client's interest lead, even if it's a very ambitious goal and we might not be so sure that it can happen. It's not our place to tell someone that that's never going to happen. We don't know. But if you can help them break it down into smaller steps and find what's important to them about that goal, they can make progress towards something that could be helpful for them. So if you have a client whose goal is to become a minister and own their own, or not own, but lead their own church, but they've never had any training, maybe they could start thinking about, well, what would be the steps to get there? And what would that look like? And what do you need to do first? And really breaking it down so they could start making progress that way. And when we write our goals and set our goals, they should be SMART goals. And so you can think about, how will we both know when this goal is achieved? And so SMART goals are specific and measurable, so we can really see what's happened. They should be achievable. My long-term goal may be to oversee my own church, but that's not achievable in 3 months for me. So what is achievable in 3 months? And make it small enough that you can start making progress. And even breaking that down, what's achievable in the next week or 2 weeks, so you can have smaller objectives. And they should be, of course, relevant to the person and time-based, or some sense of when it's going to happen. So some examples, instead of socialize more, we often see things like that in our treatment planning. Maybe an alternative that's specific and time bound is to have tea with my sister once a week. Of course, this comes from the particular client you're working with, but trying to just be more specific. So instead of being aware of current events, this person wants to read the newspaper every morning, the headlines. Or instead of reducing symptoms, in the next month, I'll learn 2 coping skills for distracting myself from the angry voices. So you can see just really focusing in how will we know when you've met this goal? And from the toolkit, we have some other tips. This is an example of a handout that you might be giving to a client that kind of gives a little summary of some tips for them on goals. So one of the questions that came up when we were looking at your pre-survey, several people asked about motivational interviewing or motivational strategies, or how do you help a resistant client, and how illness management and recovery thinks about these things, or how the toolkit approaches it, is that people really are motivated to learn things if they're relevant to them. So as much as you can connect whatever it is you're trying to teach them, whether it's a specific IMR module or some other new skill, try to connect it with their personal goals. You can also explore how their illness has interfered with those goals. And so they can start to see how managing this illness might help them meet those goals, and they'll get more buy-in that way. Conveying hope and confidence are really critical. A lot of people in our systems that we're serving have been here a long time, and they may have been told schizophrenia is a lifelong thing and you'll never get better. And so people need to hear that they can have hope, that they can move towards something. You can also help people explore the costs and benefits of changing or not changing, asking questions rather than telling them all the answers, exploring past successes and challenges. And the challenges you can reframe as personal strengths. They've been able to survive and manage despite these challenges. And helping the client see that they really are the expert and they're in charge of this can help motivate them as well. And I always like to end with this. This is a quote from one of the consumers who was part of the initial committee, who said that having strategies for coping with mental illness is extremely important, and it's hard to enjoy your life if you're constantly sick with mental illness. However, believing in yourself and having hope that things will continue to get better and looking forward to your future are also vital in overcoming mental illness. Our hopes and dreams are not delusions. Our hopes and dreams are what make us human. And I just love that. And I think that that is so critical for us to think about what are our clients' hopes and dreams and how can we help them get there. So I want to stop now and see what questions there might be. And Emily, I don't know if you can jump in or.
Yes, definitely. Thanks so much for that presentation, Dr. Salyers. We are going to open up for our Q&A time now. I see that we do have a couple of questions in the Q&A feature already. I think some of those might actually be about the slides or some links. We did have one person at the very beginning ask in the Q&A feature, is this also associated with self-determinations? So I don't know if you saw that, Michelle, or if you wanted to go ahead and just start with that question.
Oh, okay. I did not see that question. Yes, very much. So self-determination theory is one of my favorite theories of human motivation, and that we're intrinsically motivated when we have the right level of autonomy challenge, and connectedness. And so do we have a sense of control over our lives? And that is very much about helping people manage their illness better. Do we have challenge, the right level of challenge or competence? And so if we set our goals so high that we're not able to meet them, that's too much challenge. If they're so easy that it's not worth doing, that's too little challenge. So when we think about goals, we want something that's attainable, but not so far out there. We want to break it down. And then the third area of self-determination theory is the sense of connectedness or meaning. So for some people, that's spirituality. For others, it's being connected to your family or friends. And so helping people develop that sense of connectedness. So I think this is very consistent with self-determination. Yeah. Yeah, the Goldilocks rule, not too much and not too little. Everything in moderation is another way to think about that.
Thanks so much. We did have, there aren't any more questions in the Q&A feature right now, but we did have several folks asking in the chat throughout the presentation about the multiple links, particularly the SAMHSA links. So I just wanted to confirm that all of those links are actually listed on the slide deck, and that people will be able to access all those links that you mentioned if they download the slide deck from our website in a few days, correct?
Yes.
Awesome.
Yep. And I double checked them all. They work. It takes you right to the IMR toolkit. And then on the right-hand side, it'll have different PDFs. So you can download the practitioner's guide and handouts in one PDF. There's a different PDF for information for administrators. So if you want to share it with your supervisors or something like that, there's other handouts for family members or support people. So yeah, that's all on there.
Great, thank you. The next question is for, I assume, the Southeast MHTTC, and that is, how can people access the certificate of attendance that I mentioned? Those are available for download after you answer the evaluation questions that we'll get to after the Q&A. So if you complete our evaluation survey, it will automatically redirect you to the certificate of attendance so that you can download it for your records. Our next question for Dr. Salyers is, do you have any resources that you combine with IMR, like a curriculum?
Oh, often people have used, oh my goodness, I just went blank. RAP. Yes, RAP. So RAP is another way. I would think of RAP is very helpful when people already have knowledge or know a lot about their coping skills or what helps them and what has been not so helpful. And so sometimes IMR could be a nice stepping stone to RAP, you don't need to have it for all of clients to do RAP, but it can be helpful together. And wellness self-management, I saw that in here. Some people have changed the name of IMR to be wellness management and recovery, or wellness self-management. And there have been some additions to include a physical health module in there as well. Yeah. Other questions? I'm not sure where we are on time.
Yeah, we're doing great on time.
Okay, good.
We do have a question from Dr. Druss. There is often a focus on fidelity to evidence-based practices as studied. How much do you feel is lost in using one or more component of an evidence-based practice such as IMR rather than using the full practice?
Yeah. Well, as a scientist, I would say we don't have the empirical knowledge to know yet. There haven't been like dismantling studies where people have only used part of IMR, but not this part. So when we've studied it, it's usually been as a whole package. But that said, I think a lot of the skills are based on good clinical practice. And so if you're using motivational strategies, if you're helping people set good recovery goals, if you're following up on those goals, you're going to see better outcomes than you would otherwise. So I would answer it like that. I think as a researcher, I'd want more research showing if you only use this part versus the whole thing, your efficacy goes down by a certain amount, but we don't have that information for IMR.
Thank you. We do just have one more comment in the Q&A feature saying, I just want to say I have a son that is challenged with paranoid schizophrenia, and what has helped him the most are programs like this. It has provided him recovery he has not been able to achieve through traditional therapies. So thank you so much for sharing that, Donald.
Yeah, thank you. I would also like to say I have a brother who has schizophrenia, and he went through the IMR program, and it was very, very helpful for him. He was someone who liked to have the toolkit handouts together, and they created a nice manual for him to look for. When he did his relapse prevention plan, they laminated it and put it on his refrigerator so he could see the steps. So it's really nice to hear from someone else that it's been helpful. I'm getting a notice that someone is raising their hand. I don't know if we're able to do that or if they need to type something in chat or the Q&A.
Huh. I actually don't see a raised hand. But if you're in the participants and you're raising your hand and you have a question, please just feel free to put it either in the chat or in the Q&A feature, and I will get right to it.
Okay. Yeah, I'm getting a little message saying Sandra is raising her hand, but I don't know how to get to her. So.
All right. Okay. For the time being, I don't see any other questions in the chat.
Okay.
The Q&A feature. If you're still typing in the chat, we still have plenty of time. So please feel free to keep putting your questions in there while we're waiting to see if there are any final questions from our participants. Michelle, do you have any final comments to share before we start wrapping things up today?
Oh, I was going to move ahead. Let's see. A couple of comments would be, if you are looking for more advanced questions or things that I didn't cover today, I'm very happy to connect you with resources or to talk to you offline. And so my email is on there and my office phone number, and it goes to my email. So I'll get the information. So I just wanted to put that out there. We have done some work on supervisor training. We have done some studies of monitoring fidelity to doing IMR at the session level. So listening to recordings and giving supervisors some suggestions for feedback to clinicians who are using IMR. And I work with Dr. Alan McGuire, and would be happy to connect people for supervision kind of tools and things like that. So, okay. Oh, good. Thanks. I see someone saying, yeah, I thought of IMR as a whole program and that it would be very time consuming. And it is. I mean, if you do it from start to finish, I know when Kim User was putting this together with that committee, he really thought, oh, this will be like a 5-month program. But what we found is that to really thoroughly go through it, for most of our clients, it was taking about 10 months. And people may not want to sign up for a 10-month thing. But you can take the parts of it that could be helpful for you as a clinician or a case manager or a therapist to use with your clients. So that's great.
Yes, we do have one more question in the Q&A feature, and that is, what process do you use in problem-solving techniques in this program?
Problem-solving techniques. So there are actually some handouts that they have under, I believe it's coping with persistent problems that you can use. And so it really lays out a nice way to think about strategies to overcome persistent problems. Yeah. Other questions?
I don't think so. It looks like that is all the questions that we have in both the chat for now and for the Q&A feature. So I will just go ahead, Michelle, and share my screen again.
Oh, wait, I've got 2 more slides.
Oh. Go ahead.
Okay. Here we go. Okay. Yeah, please share and chat. So when we are doing any kind of training, I like to know what has been most helpful. And so what is it you plan to apply from today's webinar? So if you could take a moment to type in your chat function, what's one thing that you're going to try differently after today's webinar? Oh, and Stephanie put up a post poll. So if you could do both in the chat, what's one thing you're going to do, and then do the poll too, that would be helpful for us. Yeah, treatment and recovery goals. They should be one and the same, that if we're doing treatment, it should be related to their recovery. But trying to think about, we need to make them personal and relevant. Yeah. Making goals specific. That's really good. Oh, good. Mental health court patients. Yeah, monitoring progress towards goals. A lot of times in treatment, we set treatment goals with people and we look at them again in 90 days because we have to. But we should really be following up every time we see people. How's it going? What's getting in the way? What could we do differently to help them meeting those goals? Yeah, IMR during activities. Great. Good. I'm glad this is helpful. Well, it looks like some people are having trouble with the poll, maybe. Again, not submitting answers, but yeah, homework to reinforce the skills. Yeah, that's important. Getting them to practice. And for any of you who have tried to learn a new skill, like when I started playing golf, I had to go out and practice a lot. So that homework or home practice is really important for learning new things and making sure that they're a part of our lives. Yes, group setting. Actually, in the handouts, there are guidelines for if you're doing a group and guidelines if you're doing this individually. So a lot of people do use IMR in group settings. I've seen it done all kinds of places, like in inpatient units, when people aren't there for very long, they might still go through recovery strategies, that first one, or they might go through relapse prevention. I've seen it done in residential settings, or just group therapy in a regular community outpatient clinic. So yeah. Yeah, and the group members can help support each other. That's great. Okay, it says the poll has ended. Okay, so I can share, share results of that. Okay. So most of you are likely to use something, and that's really good. I like to see that. And if you're not sure yet, look at it and see what you think. And we'd love to hear your feedback too. I think afterwards you'll get a Qualtrics kind of thing. So, okay, so one more slide for me is just to say, stay tuned. In 2 weeks, we'll have my colleague Emily Treichler come and talk about working with clients and how to help them be more involved in their decision making through collaborative decision making as an intervention. So I will stop now and turn it back over to our Emily here for you to finish up your things. But I really appreciate everyone, your attention and your time today. This was fun to talk to you and see what you're doing out there.
All right, thank you so much, Dr. Salyers. That is going to conclude the presentation for today, and we're going to move on into the evaluation portion. And I'm going to see if I can actually put the link to the evaluation in the chat. Yay. So the Southeast MHTTC would like to thank you for your participation in today's event. We value your feedback and invite you to evaluate our event today. Please complete a brief SAMHSA required survey by visiting the link presented on your screen and the link that I just dropped in the chat. Completion of this survey will provide information to SAMHSA and assist us in planning future events. Afterwards, you will be automatically redirected to additional questions from the Southeast MHTTC regarding the impact of this event on your knowledge and skills. There, you will have the opportunity to download a certificate of attendance for your records. Please allow about 5 to 10 seconds for your browser to redirect you to get that certificate. Again, our center appreciates your participation and feedback. We hope that you will join us in 2 weeks for the second session in the Keeping It Practical series. Tools for working with clients, lessons from collaborative decision-making with Dr. Treichler, like Dr. Salyers mentioned. Again, please visit our website to learn more. That's going to conclude today's webinar. Thank you, everyone, and thank you so much, Dr. Salyers, for a wonderful presentation and for kicking off this series. Thanks, everyone.